So when is the best time to start looking for a pediatrician?
Finding a pediatrician is a very important medical decision. It's someone who's probably going to know your child for 18 years and someone you're really going to want to get to know and to trust. You should probably start looking for them around 20 weeks of pregnancy because sometimes babies come early and we want you to be prepared. A good way to start looking is to ask your friends, your family, ask your obstetrician, or even look online. Most practices will have an online presence, and you can even find ones that are located close to you.
So once you find a pediatrician or an office, what's the next step?
You should set up a meeting and tour the office. So once you've decided on a few pediatricians to meet, what you want to do is set up a meet and greet. What that is a free session where you go to the office and you meet with the pediatrician and you get to know them. When you go to meet them, you probably should bring a list of questions. You can find a list online or in baby books. However, if you don't have a list of questions, it's okay. Most of us who have been doing this for a while will probably tell you everything you need to know just by telling you about us, about the practice, and about our philosophy. Some questions you might want to include on your list are, what are the office hours? How can I reach you? How can I communicate with you? So most important, during this visit, you really want to get to know the pediatrician and find out if there's someone you feel comfortable with and you think your child will feel comfortable with and will trust throughout their life.
So what kind of access to care should parents expect when booking an appointment for their child?
It's very important to ask about hours. Our patients have the peace of mind of knowing we have express care locations at ProHealth. These are locations that are open after hours and on weekends that have pediatricians and family practitioners available to see your child. The great thing is that they'll also have access to your child's medical records.
So during a visit, what will a pediatrician be looking for as far as general development?
Monitoring your child's development is at the core of what we do as pediatricians. At every single visit, we'll talk to you about this. We'll ask you questions about their development, we'll observe your child, we'll give you an assessment of their development, and we'll also give you ways to stimulate your child's development. At some visits, we'll do very formal standardized developmental screening. An example of this would be an MCHAT. That's a pediatric developmental measure that assesses for autism, and it's given at 18 and 24 months of age. We also feel it's really important to treat your child's physical and their mental health. So at our offices, we start performing routine mental health screening at age 4 years old using a tool called the Pediatric Symptom Checklist.
So immunizations are a hot topic right now. What do you say to an expectant parent who is unsure of the value?
Immunizations are one of the most important things we do as pediatricians. We educate our parents about them. They are very safe and very effective, but there's a lot of misinformation out there. We recommend that our patients follow the American Academy of Pediatrics recommended immunization schedule, and we want to make sure that you feel confident and comfortable in doing so. We know it's been a difficult year. Here at ProHealth, we're here for you. Please give us a call and we'll help you navigate your child's care.